Hello everyone, welcome to my channel. If you're new, my name is Ale, and if you were already around here, welcome back. Quick interesting fact. Did you know that food tastes better when someone else makes it? Now, let's start. Today we're gonna talk about eating disorders. When we talk about eating disorders, we're not just saying that people have unhealthy eating habits. Not at all. What we mean by this is that there's a range of psychological conditions that lead people to have an eating disorder, and then these psychological conditions draw people to have unhealthy eating habits. Eating disorders have to do with obsession about calories, obsession about body weight, body shape. There are three things that can cause you have a higher risk of eating disorders. They can be genetics, it can be your personality. There are three specific personality traits, for example, perfectionism, impulsivity, and neuroticism, that can cause you to maybe develop an eating disorder later on. Then we can also develop something by cultural preferences or pressures that society puts on us. There is a whole variety of symptoms for eating disorders, and some of the most common are restriction of food binges, purging behaviors like vomiting or fasting, for example. They are often developed in adolescents, young women as well. People that have eating disorders most of the time have a full sense of control, preoccupation about the consumed calories that they already ate, exercise, weight, and so on. Okay, if you guys see me that I'm like super, it's because I'm freezing. Right, so the main type of eating disorders are three. And I wanted to keep it simple in this video because this topic is not to rush it, and there are details that are really important, so I didn't want it to make a long video but with so much disorders that you get confused. So I just made this video with the three main types that we're going to talk about today: anorexia nervosa, bulimia nervosa, and binge-eating disorder. Okay, so first we're gonna start with anorexia nervosa. This is the most common of all eating disorders. It develops during adolescence or young adulthood. It's also more common in women than in men, and people with anorexia tend to see themselves overweight despite of any weight that they are in. They will always see themselves as overweight. Alright, so I wanted to tell you and let you know the different symptoms that anorexia nervosa can have, and some of they are considerably underweight, self-esteem is super influenced by your body weight, restricted eating pattern, intense fear of gaining weight, pursuit of thickness as well. This eating disorder, we can divide it into two subtypes. The first one is the restrictive type, and the second one is the binge eating and purging type. The restrictive type is you lose weight by over-exercising, by fasting, or by losing weight by diet. And then the second type, the binge eating and purging type, you either eat large amounts of food or you either eat very little. After eating, you purge or you use laxatives or you exercise excessively. We have to keep in mind that anorexia can have a lot of consequences, and in severe cases it can cause heart or kidney failure, multi-organ failure, hormonal changes, low blood iron, bone loss, that it can be known as osteoporosis, anemia, depression, dry skin, also constipation and fertility problems as well. Now we're gonna talk about bulimia nervosa. This one, same as anorexia, it also develops in adolescence or early adulthood, and it also is more common in women than men. People usually eat large amounts of food in a specific time period. This is called binge eating episode, and people normally eat until they feel painfully full. They cannot control what they are eating. It normally happens with any type of food, but some of the time people have these binge eating episodes if they eat food that they will normally avoid, maybe because they have a large amount of calories or because they know it's fast food and stuff like that, and then they will purge to compensate the calories that they just took. Some of the purging behaviors can be laxatives, purging, vomiting, excessive exercise, believe it or not, diuretics, enemas, and so on. People with bulimia nervosa normally maintain a normal weight, so this disorder is way more difficult to realize. If someone you know has bulimia nervosa, it's way more difficult to get to see it like physically than anorexia. The common symptoms for bulimia are similar. Your self-esteem is highly influenced by your body weight, even though you have a normal weight, inappropriate purging behaviors, and also recurrent episodes of binge eating and lack of control most of the time. There is also side effects for the bulimia nervosa: sore or inflamed throat, worn tooth enamel, tooth decay, swollen throat, swollen salivary gland, acid reflux, irritation of the gut, severe dehydration, and hormonal disturbances. And in severe cases, it can cause imbalance of electrolytes like sodium, potassium, calcium, and this eventually can cause a stroke or a heart attack. Now we're gonna talk about binge eating disorder. It is one of the most common disorders in United States. It's same as the other two. It develops in adolescence, in early adulthood, but this one can also develop later on. This one has similar symptoms to bulimia nervosa and the subtype of binge eating in anorexia. The symptoms for binge eating disorder can be large amount of food rapidly, in secret, until you may be uncomfortably full. The person may not be even hungry. Lack of control, you can have feelings of distress, such as shame, disgust, and guilt. These feelings of distress and all of them can come when you start thinking about your binge eating habits. The huge difference in the binge eating disorder with bulimia and anorexia is that in the binge eating disorder, people don't use and don't have purging behaviors or anything to compensate the calories. They just do it. People with binge eating disorder often have obesity and most of the time are overweight. This can cause medical complications like obesity, heart attacks, high blood pressure, stroke, and diabetes type 2. Alright guys, thank you so much for watching this video. Leave in the comments your opinions about this. Give it a big thumbs up if you like my video. I hope you find this video useful and as easy as possible to understand. So just let me know that, and I will see you in the next video. Bye!